All right, one of our top stories here this morning, an important health story that parents definitely want to pay very close attention to. The State Department of Public Health confirmed its first case of measles here in Connecticut this year. Your reporter Anna Stansfield live in Rocky Hill sharing what we know about the patient and how you can protect yourself and your family. Anna.
Okay, good morning. We still don't know much about the person who contracted the disease, but we do know that they are not vaccinated. And this morning, if you or a loved one are also not vaccinated, doctors are urging that you get the shot. This is the second case of measles in Connecticut in the last 5 years. We know the unvaccinated adult who contracted the disease recently traveled outside of the country. We're told they're stable and in the hospital right now. Doctors at Hartford Healthcare say they used to refer to measles as a zombie disease because with the 2-dose vaccine, it was essentially dead in the U.S., but in recent years, it's made a resurgence. Right now, Connecticut has the highest vaccination rate in the country, right around 98%, but doctors are urging that the remaining 2% get vaccinated.
We can't necessarily keep saying the same thing over and over and over, that these complications can happen. People do die. You can transmit it to other people. It is highly, highly infectious, and the vaccine is safe.
As for the symptoms you need to be looking out for, doctors say it'll usually start with flu-like symptoms with a fever or a cough, and then you'll start to see that rash spread throughout your body. Of course, as soon as you see any of those symptoms, reach out to your doctor immediately. I'm your reporter live in Rocky Hill, Anna Stansfield, Channel 3 Eyewitness News.
All right, Anna, thank you. And Connecticut's first case of measles comes amid a surge all across the country. So according to the CDC, there were more than 2,000 confirmed cases in the U.S. just last week. Just last week. Officials point to a nationwide drop in childhood vaccination rates as a reason. Kindergarten coverage in some areas across the country dropped below the 95% level needed for community protection. However, here in Connecticut, we remain above that level.